Doctors of Reddit, what was your dumbest, r/I am very smart, patient experience? A related story from my friend, a gynecologic oncologist. Basically, a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments, like coffee enemas, and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. I don't know why this is so funny, but I can't stop laughing. Either it's the fact that this woman wanted to, and managed to, contact the Dalai Lama for some reason, or that he basically told her, "Lady, you need an actual effing doctor." To add to that, the Dalai Lama isn't some alternative medicine nutjob who doesn't trust science. He has even said that, if scientific analysis were conclusively to demonstrate certain claims in Buddhism to be false, then we must accept the findings of science and abandon those claims. I am a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal?" "No. I need you to move your head right." "Hey doc, are these cavities being caused by the anaerobic pathology microbes?" "No. They are caused by you eating snacks all day and not brushing." 80-plus-year-old patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, by the way. At some point, you kind of have to stop being polite and just tell patients and family members bluntly that you don't have time for this shit, and what you recommend, and they can do what they want, and just document everything. It happens a lot, but she sticks out all the time. I'm a veterinarian, and I can't tell you how many clients want to explain to me that their pet's illness can be fixed if they are fed a raw diet or grain-free diet or fish oil supplement, etc. Sure, whatever, come back to me when your dog's huge mammary mass ulcerates and starts leaking pus everywhere, and we can reevaluate how well her raw diet is working to fix that. Oh yes, we had an elderly woman with severe malnutrition, and her hippie daughter wanted us to only give her raw, unpasteurized, goat's milk. We did everything we could to convince her that her mother wasn't getting enough nutrition. We even tried to allow her to bring in the raw, unpasteurized goat's milk that we would supplement with the FDA-approved formula we wanted to give her mother through the feeding tube. We finally had to become pretty blunt with the daughter and let her know that her mother was going to die due to malnutrition, due to the daughter's unique views on what was a proper diet for her mother. This one happened to my ex-father-in-law, and it's funny, but it's not. He was a surgeon, very gentle, soft-spoken guy, and came out to tell them the biopsy results, to which they responded, "Praise Jesus, it's malignant." He had to explain that malignant meant bad. ERRN here, not a physician, but you may find this interesting. Young adult male, presence with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself, trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He's admitted to the floor and gets IV antibiotics. What? Oh boy, it's my time to shine. 1. A guy brings his wife to the ER. Her leg has a 7 cm by 7 cm wound, diabetic ulcer, with greenish-yellow pus, and what looked like a few maggots. Now, I took one look at her and referred her to the surgery department for admission. But the hubby is adamant on his wife's kidney disease. "But doc, it's just a wound, you gotta fix her kidney first, doc. I read online that diabetes can cause kidney failure, and you gotta do something for that." I spent an hour convincing him that his wife would probably die before the kidney damage sat in by sepsis from the clearly infected wound. 2. During my pediatric internship period, one day, I was in charge of general ward. Basic things: look after the kids, solve small complaints, cough, breathlessness, etc., etc., evaluate new admissions. Now where I work, interns are supposed to draw blood from children for tests. So, I went about my job, and there's one little tyke who's a bit too active and jumps around, when he sees the needle. The mother gives me a vile look and says, "You lot are just puncturing my child, for your education." At which point the kid just screams even harder. Yes, I'm studying a blood draw, at 2 in the morning, by waking up a kid. That's what she thought. Took a fair amount of convincing too. 3. I took care of a child that got measles. The mother and father was strongly anti-vax, but was yelling at me, "How can modern medicine not have a treatment for measles?" At which point I told her, there was a preventive method, but you didn't use it. She asked me what it was, to which I replied, "Vaccinate your child." She said, "You're just one of them pharma lobbyists, aren't you?" Yes. I am a pharma lobbyist, who wants to kill children. 4. A lady comes screaming into the ER, now she's all dressed up, so are her 2 grown daughters. All of them screaming hysterically, that their mother is going to die. I go by them, and nearly get tackled by the sisters-in-law husband, of one of the daughters. Save her, she's having an embolism. Shaken, I examined the lady, asked her where she was coming from, a wedding, that explained the dress. She, apparently, had a bit too much of potatoes. A shot of pantoprazole later, her embolism is gone. She had a bad case of fart embolisms. One thing I will never forget, is how I learned never to be mad at a patient. Now this was, when I began as an intern. A patient had intestinal obstruction. We inserted a nasal feeding tube, as the patient could not have anything, perorally, before the surgery. Problem was, that they would always come and complain to me about how I didn't stick it properly. You have to stick the end protruding out of the nose to the nasal bridge. After 2 to 3 such episodes, where I reluctantly dressed it, they complain that the tube is out of the nose, and lo and behold it is out. It's very uncomfortable. Most patients try and pull the nasal tube out. I replaced it, like 4 times. Poor guy was fed up by then. On the morning of the surgery, his wife comes and asks me, "Doc, can you just remove that tube, so that I can give him some coffee?" Now I got totally mad. I was working a 72-hour shift, so I scolded her by saying that if she or he didn't want the surgery, then I couldn't do anything, and it would be nice if they gave me some peace. She didn't say anything. The patient, 50 years old, with no other complications, died on the table. I couldn't face her. The moral being, doctors know more things than patients. But it's not always wise to bite their heads off. I could have convinced her it was impossible to remove the tube before surgery, in a calm way. Since then, I've tried to be a better speaker to patients. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure, to diagnose glaucoma. He said, "That puff machine gives you glaucoma," and we weren't going to pull that on him. He told us his father got an exam, and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma doesn't have any outward symptoms before you start going blind. This dipshit just told me he has a very strong familial disposition to glaucoma, and refused to be tested for it. Edit, spelling. Edit 2, woo, that took off. Also, puff isn't that bad guys. Try contacts, your eyes stop fighting back pretty quick. The puff is a lot better than the old machine, it just hits you on the eyeball with a little ball on a lever. Another edit, I also have plenty of patients that don't understand family history. I interview patients directly so we don't have any real paperwork, and too many people can't answer simple questions. Do you, or any of your direct family members, have diabetes? Yes. Yourself, or your family? Alternately, if yes to family members, they start listing their spouse's family, or stepchildren. Not how genetic disposition works. Or after getting no answers to diabetes, hypertension, glaucoma, thyroid problem, heart problems, etc., I ask if they take any medications. Yeah, atorvastatin, thyroidazine, metformin, and low-dose aspirin. Oh, so, you have everything I asked about. Check. Want some more? Way too many people don't understand presbyopia. As you age, your lens hardens, and can't focus up close anymore. Of course, when this is explained, I get a lot of people who believe they're way too young for bifocals. No. 60 is not too young for bifocals. Why doesn't the doctor have to wear bifocals? He does. He's wearing progressives, you don't see the line. Or after trying to get used to multifocal lenses, for a few days, giving up and demanding we remake them as single vision, and then getting mad at me again, when they can't read with them. I never needed bifocals before, why can't you just make me regular glasses? Regular glasses always work just fine. Yeah, you used to be 20. Also, you came to see us, because you can't read with your regular glasses. In the same vein, these same people complaining about their own insurance to me, because progressives are expensive. Aligned bifocal is covered entirely. Progressives cost a lot. I can't have lines in my glasses, like an old person. Then you want progressives. This easily triples the bill. Why are you so expensive? I need to be able to see. Yeah. You need a bifocal. You don't need a progressive, you want a progressive. Insurance pays for what you need, not want. I actually had a guy make me talk to his insurance agent about him needing medically necessary progressives. A progressive lens is never medically necessary. Stop being cheap, and listen to what I say. I am not a salesman, I am a medical professional, stop acting like you know better than me. Not a doctor, but a patient, whose mother was like this. The doctor had to speak to me, on the side, because of it. My grandmother has Crohn's disease. Very badly. It skipped my mother and her brother. When I was 15, over the course of 6 months, I went from being 5 feet 9 inches and 190 pounds, to being 110. I was a skeleton, extremely anemic, and coughing up blood. My mother was convinced it was something else. I forced her to bring me to a doctor, and she spouted off all these possibilities. She then talked about what she Yahoo'd. Not even Googled. Yahoo! About genetics and such. And Crohn's can't skip generations. Well, the doc said, just in case, we're gonna run some tests. Long story short, I have Crohn's in my throat, and small intestine. So does my cousin. It just skipped a generation. I worked for an optometrist, and it was the month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual, for a first eye exam. Better late than never, I guess. The mom was well-spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy, and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time, since he's nearsighted, and basically can't see clearly, past 5 feet in front of him, and will definitely need glasses for school. For some reason, this caused a switch to flip in the mom, and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does, because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out, and that doctors are all con artists, trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion, and gave her a copy of the kid's prescription, and sent them on their way. About 4 months later, the lady is back, asking for another copy of her son's prescription. Apparently, the first semester midterm results were in, and her son failed them all, because he couldn't see the board in his classes, and needs glasses. I didn't get glasses until 8th grade and I've always been extremely short-sighted. For some bizarre, probably anxiety-related reason, I went above and beyond to keep it a secret, so it wouldn't come out that I was defective in any way. After getting them, I did about the same, academically, since I'd come up with a lot of coping strategies over the years in school, but holy shit, did I suddenly get 100 times better at sports. I remember my PE teacher being pretty shocked. Had a young woman with recurring UTIs, that began after a recent partner, and with no STDs, went through the standard questions, trying to figure out what could be causing them, and eventually found out she had been lubricating with jelly. Not KY jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem, and she stopped getting UTIs. Oh, I have 2 good ones that come to mind. Clinical pharmacist here by the way, with one story in the ER, and one in the pharmacy. 1. ER physician told me this one 16-year-old boy presented to the ER with an extremely swollen discolored penis. Apparently, he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected, and he was hospitalized for a week or so. 2. One day in the pharmacy, a girl comes to the counter, requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it, because she just got a 28-day fill, less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each, and was adamant that was how they needed to prevent pregnancy. Where to start? 1. Picture a middle-aged man. His index finger is 5 times the size of the rest of his fingers. It smells, it's leaking pus, there's necrotic tissue. Basically, one huge infected cancerous finger. He was a firm believer in not taking any sort of medication, including antibiotics or chemo. Died a few weeks later, but he did manage to tell us we were all idiots before he passed away. 2. Patient was a young child who came in with an extremely high blood glucose level. Once she was stable, we did some teaching and kept her for a few days for observation. For some reason every time I checked her, her levels would be extremely high, although we were appropriately treating her. Turns out, her family would bring her fast food for every meal and hide it in the side table. More teaching and resources were put into place. 3. Had a mom in hysterics because she was convinced that her neighbors, friends, stepsons, teacher's dog has MRSA, so her baby was going to die. It took everything within me to not tell her that most of the hospital staff have MRSA. But it took 3 hours for me to finally calm her down after I called infectious control, her pediatrician, gynecologist, and family doctor. Yes, I had to call all these people. Yes, they laughed at me. Yes, she was beside me the whole time, questioning their judgment. I love my job, but at times, it makes me crazy. Edit. Just had some amazing people inform me, with several scholarly documents, that MRSA isn't as prevalent as once thought. It's only about 5% in hospital staff. Thank you, wonderful people. 70-year-old female tripped and fell 2 days ago. She came in with hip pain, but reports after the fall, her nose was bleeding. She had landed on her nose. About a year prior, her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient. I raised my voice and put down an authoritative, "No, you are wrong, just stop it." My dad is an emergency nurse. He experiences the same thing doctors in the ER do, maybe more so, because he's the one in the rooms more often. Anyway, here's a good story from him. I had a patient come in with several pages he printed off the internet. He kinda slammed them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, bloody stool, and fever among other things. He insisted he had schistosomiasis. He was being a real jerk about it, like we're wasting time, since he already knew what he had. So, I asked, when did he get back from Africa? And he said, "Africa? I've never been to Africa. What the hell would I be doing in Africa?" I proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River, or other rivers, in developing countries, like in Southeast Asia. He got pissed off at me, because he thought I was being a smartass. He got seen and diagnosed with gastroenteritis, the stomach flu, the bloody stool. He had hemorrhoids. Med student here. On my pediatrics rotation, a mother refused vaccines for her kiddo, after educating herself. When prompted as to what she was using as her source, she replied, "My own brain." Lovely. Maternal instinct is a popular anti-vax reasoning now. Terrifying on 2 levels. 1, that people would actually consider themselves a better source of information than decades of research and results, and 2, that they honestly don't realize how easily they are influenced by outside sources and really think their decision came from their own reasoning independently. Not a doctor, but I'm a nurse who worked in the OR at a trauma center. Was doing surgery on a 19-year-old who tested positive for meth and cocaine, who was grilling the anesthesiologist about every drug we were going to use in surgery, because he doesn't like putting chemicals in his body. Got a stick with that organic, fair trade, non-GMO, cocaine. Another Tales from a Trauma Center, since you all liked the last one. Guy is trespassing in a junkyard, and gets his arms and legs effed up by a pit bull. Have to clean out all these wounds. Flash forward to 3 a.m. that night, I get called in to do a case. Apparently, the guy left the hospital AMA to go get revenge on the dog, and the dog bit him in the face, breaking some facial bones, and poking a few more holes in the process. Classic. Not a doctor, but I'm a medical technologist. There are plenty of I am very smart moments, but this one was recent. Did a finger stick for a patient, ensured the little cut stopped bleeding, and then put a band-aid on it. Told her to collect a urine sample for testing. Test came back strongly positive, 4+ reading, for blood. She complained to the doctor that there is no way she has blood in her urine, and that the blood from her finger stick must have entered the urine, throwing off her reading. She said it was my fault, that I did her blood test before her urine test, and I obviously made a mistake. She repeated the test later in the afternoon, still at 4+. Came back a week later, still at 4+. The look on her face when I told her, "Sorry, ma'am, your result is still positive," was priceless. Just got this story from my girlfriend's stepdad, who is a neurosurgeon. He had an obgyn friend who had a couple who couldn't get pregnant. Apparently, they had been raised in some religious fundamentalist cult and didn't understand how sex worked. The guy was just rubbing his penis against her leg and ejaculating on her thigh. I think this sort of thing is way more common than we think. My mother is a gynecologist and had a woman come in to talk about possible infertility. She was 18 years old and had had sex with her husband a single time and didn't get pregnant, so she was upset and scared and demanded tests and all sorts of things. She had been taught nothing more than sex equals procreation, to the extent that she thought every incident of sex equals one baby, and presumably, couples who had 3 kids had only had sex 3 times. So, my mom had to give this married woman a sex ed lesson. I used to believe that when I was like 12. Then I caught my parents going at it, and got scared I'd have another brother. Mom promptly explained that that won't happen. I was relieved, and felt like I understood sex. And then mom told me she was pregnant. Patient had a hard time getting pregnant. Finally conceived but miscarried. Patient has a D&C, so she can try again. This time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment. But she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the docs saying, "We don't know why you have these constant high levels of HCG in your blood, and we are worried."